Okay, now we're live with Suzilla.
Yay! Hi, Suzilla's here. Susie and Matt, welcome to our podcast.
Correct. And today we're getting back into that deep subject that we've talked about for almost a year.
Almost exactly a year since the shutdowns happened.
We started our first podcast in April.
Well, I'm just talking about topics.
Topics.
Well, yeah, we've been doing this for almost a year now.
Almost a year now. Yeah. We got the call to shut her all down. Oh my gosh. And well, yeah, because that was the first one we had to shut down for about a week or two before we got all the hand sanitizers and everything back up.
See, you're jumping topics again. Or for a second there, I thought you were talking about our podcast. Now you're back onto COVID.
Yeah, because
COVID happened in March. Well, that's when things shut. That's when the lockdown started.
Yes.
It started a little bit earlier, but it got woofed.
Yeah,
that's a technical term, woofed.
Woof. We've been handing out like the coolest hand sanitizer in the world.
He loves that one. He really does.
And masks.
Oh, thank you. Yeah, we got awesome masks. If you need a mask, come get one.
Yeah, come get one.
Yeah, thank you, Humana.
Yeah, they sent us a big box
of these
case,
and they're nice. They're good fabric masks.
So yeah, we've been throwing those out as quickly as we can.
Oh yeah, if you need anything sanitizer, we've got sanitizer, we got masks, we got lip balm.
We got lip balm. We still got some lip balm.
Lip balm's good because if you're like me, you're wearing your mask a lot. I don't know about you, my lips get dry. Yeah. So it's good.
So yeah, there's some perks with coming in, but the first.
Well, in fact, just get to meet us.
Yes. The first thing we want to talk about was the health enrollment.
Yes, we are in a COVID-fueled special enrollment.
Correct.
Right.
Because our state runs its own exchange. We're able to kind of control and dictate what the state does.
Right. Now, this was a federal impetus, though.
What they did was, Biden said, hey, healthcare.gov, we're going to go now.
Right. And they created their...
and we matched up with it.
Right. Now, as a state-run exchange, we didn't have to, but we did because we wanted to.
Correct.
And Washington State is good at doing the right thing.
Yeah, we've got some extra perks here. We're going from, it started February 15th and we're going to May 15th.
Correct. Isn't that what the...
That's what the federal...
Yeah, the federal. We're matching the federal timeline.
And, the healthplanfinder.org.
Healthplanfinder.org. Yeah.
Is kind of the king bee. A lot of people are finding us because they go and they get confused because it can be a confusing site.
It's a little more complicated than the initial concept, but that's what we're here for. Correct.
There are 11 enrollment centers scattered throughout the state.
Yep.
We happen to occupy North Central Washington.
Correct.
We've been doing this. We went through our 8th open enrollment.
Yep. Since we've been at this since day one.
Day one, teaching people how to use it and how to enroll.
Mm-hmm.
It's no big deal. It costs nothing.
Yep.
All the enrollment centers have additional training.
Mm-hmm.
Some of us have additional products.
Yes.
For example, we've got like Medicare.
Yeah.
That's a huge one. We could answer Medicare questions.
Yeah, absolutely. All day long. We also offer, we can also show you dental options or vision options.
Or travel if you want to travel, because there are folks traveling.
Mm-hmm, exactly.
And they want that coverage for that outside their normal network.
Right. And then one nice thing about the travel plans is if you can choose one that if you're right now, for example, the plans that we have primarily in North Central Washington are very tightly networked.
Well, actually, that's kind of the thing the across the state.
Okay, it's not just okay. So what?
Yeah.
Okay, you're right. What boils down to is a lot of insurance companies have tight networks. They're not. It's hard to find one that you can use in Florida if you buy it in Washington.
Correct.
It's a PPO thing, but with a travel plan.
Well, I'm gonna let's back it up there. We're gonna back it up there.
Let's go back it up.
I'm gonna back it up here, and because I've seen this used by advertising.
Oh.
There are some kind of crafty people that are advertising. We've got a PPO plan.
Okay.
All right, and we know, and these are dropping. These are like Facebook advertisers and stuff, and they're stressing that they've got a PPO.
Yeah.
That's the power word they're using, the power phrase to sell.
Yes.
Because in reality, there's not a single PPO plan that is endorsed by the Office of the Insurance Commissioner in Chelan County.
Yep.
And I know as soon as someone's advertising that, they're playing dirty games.
Yeah.
And if they're playing dirty games on the way in, they're not going to do you right.
Right. So that's your warning for the morning.
That's your warning for the morning.
We'll have to save that phrase for later.
Yeah, that's a good one. But yeah, we see a lot of dirty tricks.
All right, avoid dirty tricks. But the theory, because you can't find a PPO, a preferred provider organization plan, which means you need to stick in your network in order to get your coverage paid for. If you are traveling, and that's perfectly fine, traveling nationally, internationally, wherever, and you purchase a travel plan, a good many of them have a setup where they will bill the travel plan for medical needs first. If you get sick on your trip, if you fall down the Alps and break your legs, they're the first payer. And so they're your primary medical insurance for that period.
Yes.
And that can be really handy if you're traveling out of network. So that's why that can be a really useful tool. And they're not very expensive.
Correct. And it's a good way to kind of shore up coverages. We've been doing the same thing with accident plans and high deductibles.
Yes.
Because
if you have if you have a high deductible or a high out-of-pocket maximum, you can pick an accident. And it's especially helpful if you're klutzy.
Yep.
You can purchase a accident plan that will cover that dollar amount. So even if you do have something go wrong, you can, have your bills paid for a little more easily.
So yeah, that's kind of why you want to stick with, if you've got any sort of questions, don't hesitate to reach out to an enrollment center.
Right, because we're designed to help. Yeah,
answer questions and do that. We kind of do things a little bit different here. We will actually go out and do additional training. Yeah. Both of us, you did the Out to Enroll this week, didn't you?
Yes.
We both did the Out to Enroll training, which was LGBTQT training. We do refreshers like that with different organizations to make sure that we're got the latest and greatest. Right.
We really want to be sensitive to everyone's needs.
Well, that's the thing, is we take care of everybody.
Day one, our mandate, we put it down hard in bedrock. Everybody that comes across our threshold is treated with respect and dignity. Regardless of anything.
Yeah, it kind of makes the health insurance guys' head explode. Yeah. Because we will take care of literally anyone that walks through the door.
Yeah, we don't. Theoretically, we're not. No one's supposed to cherry pick clients, but
they do.
But it does happen. If you treat us like dirt, though, we're gonna stand up for ourselves.
Well, it's not just to stand up for ourselves. If someone's abusive or disruptive.
We don't tolerate that.
We don't tolerate it.
No.
It hasn't happened. It's happened in other agencies.
Yes.
I've heard of that happening.
Yeah.
And it's like, I had to point out to a visiting insurance agent the other day that I'm the guy at the door. I'm over 300 pounds and I like to box. So I usually just have to stand up. That takes care of that.
Nobody intimidates me.
No one intimidates me, and for some reason I intimidate people.
I know. I've been told I intimidate people. I haven't figured that out.
Weird. So yeah, this enrollment period, we've enrolled 1,700 people the first 9 days in Washington State.
Oh, that's good.
And those are paid plans. So that's regardless of Apple Health.
Oh, see, I hadn't seen those numbers. That's good to hear.
Yeah, I had to sneak because everything's kind of this weird stealth.
Yeah, for some reason there's like no outreach on this,
and that's one of the things we wanted to bring up is, well, when we got the notification that the special enrollment was happening from the Washington Health Plan Finder, they said, "Oh, hey, we're hoping that the feds kick in for some outreach."
Yeah,
well, we haven't seen that.
No.
Our local paper. Yay, Wenatchee World!
Yay, finally.
they actually grabbed information way over in Spokane.
Yeah.
Some goofy thing. It's like, oh, we've been sending you guys press releases for 4 years or more. We've hit your front page a couple times, and
not since they got bought.
And that's kind of the actual information blackout.
Yeah.
In Central Washington is they do this weird, and they recommended healthcare.gov.
Healthcare.gov is great if you don't live in Washington State.
Correct, or don't have a state exchange. So they're using antiquated information.
Yeah.
And it's like, no, if you want information, go to one of the enrollment centers.
Because we're up to speed with what's happening in our area.
We even did one better. We went out and had a video created. Yay, Ricky Lake.
Yay, you might remember Ricky Lake. She was the original Edna Turblad. Edna? No. She was on Hairspray. She's the original in the Hairspray movie. The girl.
Oh, yes.
Yeah, and she had her own talk show.
She had her own talk show, and she's been a big advocate for health.
Yes, and she's putting together she's doing a lot of producing and advocating, and she's putting together a film about birth control, I want to say.
Correct.
She's done a lot of awesome things.
So, yeah, for healthcare. So, yeah, if you just want to just jump on the Facebook and share that video.
That'd be awesome.
That helps because that gets the information out there.
Yes.
And that's going to be huge, is getting that information out there, because we're seeing a lot of first-time people that have shopped it. Our lowest for uninsured was about 6% in our state.
That's actually pretty. That
was a couple years ago. During the height of the pandemic, while we were all open and we were telling people, hey, come to enrollment, it got up to about 13%.
Really?
Yeah.
Oh, because people were losing their jobs.
People were losing their jobs.
And didn't know what to do.
And we said, hey, come to the enrollment center. We can walk it through. We're like an HR department for the individual.
Yeah,
no big deal.
That's a good way to put it.
And, if you had no income coming in, it was either no cost.
Yep, or low cost. Yeah, there's a lot of, with your income being slashed, even with unemployment, which for a lot of people was pretty sturdy.
Yeah.
We were still getting some really good premiums for people.
So that's why we tell there's help available.
There is.
And you don't have to be confused by it's actually easier to enroll in healthcare with working with an enrollment center.
It is.
Than it is when you have one through an employer.
Mm-hmm. Well, yeah, because we're actually training. You can actually get a hold of us.
So yeah,
I worked with so many companies you couldn't find HR to save your life.
Yeah.
And we're very friendly.
Yeah, we kind of
we don't work for your employer. We work for you.
Yeah. So it's kind of nice that way. So the next thing we want to really talk about is the vaccine schedule.
Yeah, they updated that yesterday. I sent it to you on your Facebook. So if you want to bring that up, you can see what the thing is. Clickety.
Because that is
they're in WAGA.gov. That should be the info. That should be the infographic. There you go.
Okay. Oh, so they upgraded that graphic.
That is updated from yesterday. It was updated yesterday.
Okay, so we know that we're in the 1B.
Right. We still are 1B.
1B, which was the 65 and older, 50 if you were like
taking care of other people,
taking care of your grandkids.
All right. There was a lot of things.
And then what they rolled in there were the educators and staff for the pre-kindergarten through 12th grade and the child care providers.
They got the people who are taking care of kids in there, and that's awesome. I am really, really pleased to see they got the teachers in there. I always thought they should have been in the first place, but I wasn't the one making the rules.
You didn't have a million vaccines to throw out.
No, that's true.
That's the thing is the reason why we have a schedule is because of the limited availability.
Exactly.
Our state's goal is to distribute 45,000 vaccines per day. Mm-hmm. We're hitting that now.
Oh, good.
We actually averaged this last week about 43,000.
That's great.
For the entire 7 days.
That's great.
So we're
hitting it.
We're hitting it. About 8% of the state is vaccinated.
That's a start.
So yeah, we've got some. So the 1B tier 2.
Right. That's the next batch.
We're looking at estimated March 22nd.
Right. Hinges on a lot of different factors. I mean, how many people who are up, if we got the first waves done.
Yeah, it's going
and then if there's still the flow of vaccine coming in is still strong.
Now, the one I'm excited about there is, because we know a bunch of people that are in this category, is the 16 and older that are pregnant.
Yes.
Fall in that category.
They do. Or have a disability that puts them at high risk for severe COVID-19 illness.
Correct.
So if you have a significant immune system situation, that puts you in that category.
Then it's going to be the high-risk critical workers in certain congregated settings like agriculture. That means the treetops.
Stemilts, and Gebbers, and all of them.
All those ones. The fishing crew vessels.
That's great.
Food processing.
Grocery stores. Grocery people. The folks that are dealing with the frontline people who are so underrated, they are getting an opportunity to get immunized sooner.
And this is going to be around March 22nd.
March 22nd
is the
estimated date, and hopefully that will stay true.
Correct.
Or even sooner, but I'm not holding my breath for sooner.
And what we did, because we kept getting when am I going to get vaccinated? What we did is we created a robot.
Yes.
Because we got
freaking genius over here.
I popped in there, and it looks like about 9 people have used it so far.
Okay, good. That's 9 people who understand how it works.
Correct. And what we did with this COVID robot, if you go onto our Susie Health Solutions page and you hit Messenger and you type COVID, COVID, it'll pop up.
Right. And it'll take you it's a step-by-step instruction program.
Correct.
It does not sign you up, but
it does not enroll you.
But it does take you to where you need to go, and it can help you navigate through the instructions.
And I'm gonna walk people through. The first one it takes you through is the phase thing. It finds out what phase you're in.
Right.
You're gonna want a copy of that. Right. Either print it out or click it and save it on your phone. The next step is where do you set your appointment? Because once you get the magic purple ticket, and it shows an example there of a purple ticket, you want to find out where the vaccines are. I had someone that was looking for vaccines, like, go to the second link here, and boom, you'll see who's got links and who's got stuff available.
Exactly. And then they'll set you. The next is appointments.
Oh well, no, that's where you set your appointments.
Oh, okay.
is directly with them. The third thing we did with it, the third thing is because we know people are going to have difficulty navigating. Yeah. And they're going to need additional help. Yeah. So what we did was we reached out to a couple of our local resources and said, hey, who's providing assistance if they call in? And and Cafe texted Alma and talked with them briefly.
Oh, that's a great resource.
And they're also doing the Hispanic outreach.
Very important.
And then our health center, our Department of Health is also doing something.
Oh, good.
So there's 3 phone numbers from them and one from Cafe. And here's the nice thing: if you click on the more help, you go down. You just have to push a button. And it'll dial on your phone. Yeah,
it's very cool. Now, the nice thing about Cafe is if you need it in Spanish, they are seriously bilingual. It's English, Spanish bilingual there. If you need it in, say, Italian, it's a little tougher.
It's one of those ones. I'm working on getting the entire thing translated. My translators are slower than me. It's one of those things. When you do stuff, sometimes you have to rely on other people,
right. And that's not a bad thing.
It's not another thing.
But Cafe, if you or someone you love needs to go through this in Spanish, Cafe is your phone call.
Yeah. Now, April 12th is when the 50 years and older with 2 or more
comorbidities or underlying conditions. Comorbidities are things like heart disease, diabetes, obesity, cancers. Yeah. All kinds of a comorbidity is an underlying health condition.
Correct.
Terrible word, but it's
it's the whole death thing.
Yeah.
Because when and that's the thing when they do death certificates.
Here we go. There's the definition. Morbidity is a medical term that means illness or disease. Comorbidities means more than one illness or disease occurring in one person at the same time.
You stack them up.
You stack.
Yeah.
And because when you have a comorbidity, you increase your chances of having a poor outcome if you catch COVID.
Correct.
Right. So they are trying to protect people who have comorbidities, and that's the 1B tier 3 batch.
So yeah, you got that, and you got the 16-year-olders that are going as well. On April 26th.
Right.
Then April 26th is the estimated for the 1B tier 4, and that is people, staff, volunteers in congregate living settings, correctional facilities, group homes for people with disabilities, and people experiencing homelessness.
So basically, it's the people who are living in working or living in group situations that have not previously been immunized.
Correct.
And then the next batch is everybody else.
That's sometime in late spring, early summer.
Yeah,
so.
I suspect the 1B tier 4 is not going to be a very large group, which will bring the future phases, which they'll break down as we get there. They haven't pinned those down specifically.
It's gonna change because the Johnson & Johnson vaccine got approved.
Yeah.
It also got endorsed by our state because we're part of the Pacific Pac.
Yeah.
Which goes through the extra safety measures. It's a one shot.
Which will speed things up.
Which will speed things up. It's one shot. It doesn't have to have the super chill chest.
Yeah. It's still, I think it needs to be refrigerated, but it doesn't have to be like super frozen.
Yeah, it doesn't have to be the super extra cold. Now it's important because it's like the other ones. It's been 100% effective from the serious, the death, the incubation. The incubators. It presents 100% against the heavy duty stuff. It's I think it's only, I want to say it's 70% against the actually catching it.
Oh, okay. So you could catch it, but it won't be severe.
It won't be severe. It's kind of like the flu shot in that way.
Okay, but doesn't that mean you could still carry it to other people then?
Still carry it. You can, and that's why they want the mask on as long as possible. Is because you can still get it. Even with the super duper
it's not
the 2 doses,
right. It's not going to keep you from catching it necessarily, but it's going to keep you from affecting you. Your immune system will fight it more effectively.
For now. And I have to say for now. And the reason why I'm saying for now is the variants that are showing up.
Yeah, we're seeing some mutations. Although I hear the Johnson & Johnson one is quite effective against the mutations.
It depends on what mutations. There's a nasty one out there.
I don't think I heard about that one.
Yeah, well, is
it relatively new?
It's got some stealth. It's got the mutation is the E484K or EEK mutation.
What a name!
It is what a name. This was seen in South Africa.
Oh, okay.
And also in New York City in January.
Ooh.
So and it's got this weird kind of stealth gene to it, so it's kind of evading the immune system, and it's not as effective against some drugs that have been treating COVID.
Oh, it's sneaky. It hides from the immune system.
Correct.
Oh, geez, that's scary.
Well, it's what happens when you've got people that are acting as human petri dishes.
Yeah.
So there's that one out there. The Brazilian one has been able to reinfect.
That's the one that's doing that one.
That's the one, and it's been spotted 10 times in the United States in 5 different states. The UK strain, which you also might have heard about,
I haven't heard about that one,
is 50%. They estimate about 50% more spreadable. And that transmission rate is kind of big when it comes to death rates. If it's easy to transmit, it has a chance to infect more people.
Well, here's the thing. If you are immunized, you have a chance, even if you do contract it, your immune system, hopefully, except possibly this South African one.
South African one, and like I said, the New York one.
Right. You're more likely to have your immune system fight it off, and you'll be less likely to get either sick at all or severely ill.
Yep.
But you still will be contagious.
Correct. And there's also a California variant that's been working that's a little bit more contagious or higher transmission rate than the normal COVID strain.
Which is why you still need to wear your masks.
Correct. And
until everybody's immunized. And even then, and then we still need to adjust and assess with every step and every variant that comes up.
Well, remember when Biden said, 100 days, first 100 days, I want, 100 people, 100% masking.
Yeah.
He actually said that because he wanted to slow down the transmission rate. Because if you slow it down and you start backfilling with that, the vaccines,
we get a stronger system in place.
Well, it's not you get stronger suspicion, is you stop the spread. And that's the important thing is you stop the spread. So instead of having, I believe it's like for everyone that catches COVID, it's like a 1.5% 1.5 on transmission, which means that you're going to transmit it to 1.5 more people. Yeah. And that's what's dangerous about those super spreader events. Instead of that 1.5, you're actually transmitted to like 3 or 4.
Right. You start getting that.
Yeah.
I can't think of the word.
It's a cascade effect.
It's a cascade effect, but no, it's the. Oh, she told 2 friends, and she told 2 friends what's the word I'm looking for? It's a mathy thing.
Yeah, it's a mathy thing. So that's why it's important to still maintain the masking, the social distance. Yeah. Because while we've seen some positive, we're seeing some that are just kind of stabilizing. Yeah. And there's a common talking point that's kind of crushing common sense. And you saw it in Texas and you saw it with Mississippi. They said, "Oh, we're going to open everything." Yeah. Right in time for spring break.
That's what that was about.
So you get everyone.
I missed that.
Well,
I didn't put those pieces together.
Well, yeah, it's.
I was busy being ticked off.
You're busy being ticked off, and it's revenue.
That's exactly right.
Because they have under supported the businesses, the small businesses, the bars, the restaurants. Those restaurants and businesses are screaming for help, and so you've got irresponsible leaders that are saying, "Oh, we got to open." Yeah, and they're forcing the agenda. We actually have seen that locally, in like the Republican Party pushing forward a plan to open. They're not in charge of anything. They're not having a conversation with the governor who's in charge of that and looking at working with the health district. We got to work together. Yeah. Our Chamber of Commerce did a similar letter talking about on how important it is to open instead of how to open safely.
Right. They're creating a problem by not actually solving the problem. That didn't come out right. They want to say, okay, well, here's the answer, but they're not giving steps how to get to the answer.
What they're doing is they're pushing a political agenda.
I know.
And then these are individuals that will put their lifestyle ahead of people's lives.
And that's one of the things that really makes me incredibly sad is how this international health crisis is a political event. It should have never gotten that way.
Oh, of course not.
No,
but
we just have to fight it tooth and nail.
Well, it's not. You don't have to fight it tooth and nail.
I want to.
Okay, you go to the punching bag at home.
Okay, we'll do.
What this is all about is unity. Yeah. Do you care about your neighbors? Yeah. Yeah. So what you do is you maintain social distancing, because one of the things that's being talked about is herd immunity.
Yes, because there are people who cannot take immunization for one reason or another.
Correct, and there's some wide numbers. Yeah. For example, measles is a good example. To have herd immunity, about 90% need to be vaccinated. Right. Because it's highly contagious.
Yes, and very dangerous.
And kills people. Polio was only like 70% because it wasn't as contagious. It didn't have that, those remarkable, highly infectious rates that like measles does. So it was down at 70%. COVID's probably going to fall somewhere in the middle of those.
Mhm.
So when someone says, "Oh, well, hey, I've got the vaccine, let's go crazy," it's like, no, what you want to do is you want to hit 70% at least,
Yeah.
before you say, okay, yeah, let's open up. England is a good example, because they have, was it Boris with the wild hair? And they're actually slowly opening up, and they're looking at a June opening. Oh, that's that phone.
I think that might be the world telling us that it's time for us to.
It's a perfect way to end it, because that's going to go to our voicemail.
And it's time for us to. It's been 30 minutes, so we'll say thank you for joining us on Susilla.
Correct. So yeah, get the word out.
Get immunized when your stage comes out.
Get immunized.
We're gonna ask.
Stick with the social distancing and masking. If you need masks, we've got masks.
Yes.
We've got hand sanitizer. There's a lot of businesses in place that have changed their model so that they're supportive of that environment of being safe while they're still doing commerce.
That's right.
The COVID relief bill is going through Congress because the Republicans said, "Oh, we're not going to help you at anything at all." Kamala Harris came forward and
she cast that vote.
She cast that vote so it could go forward. They're on the vote-a-thon. So it's going to be garbage endorsement after garbage endorsement by the Republicans.
Yeah.
We've seen that before, and there'll be lots of rejections because they'll be got you.
So basically, what they're doing is they're doing a giant morass of yakking.
What's happening is the Republicans is putting in stalls. They're just going to stall procedure. They did that last night by making their interns read the bill. It wasn't the Republican senators. It was their interns that had to read it, and they spent 10 hours reading it.
Is that the filibuster thing they're working on?
No,
that's different.
That's different.
That's a whole nother topic.
That's a whole different topic.
That is another
topic. We're going to get going.
Thanks for joining us.
Thanks for joining us. Spread the word. That's very important that people know that yes, they can have health insurance.
Yes.
B, they're not locked into it for an entire year. You can make changes throughout the year. And there are 11.
You can't make changes on your health insurance throughout the year.
You can if you get an employer plan, drop your health coverage.
That, yeah.
And most people don't understand that. They think, oh, we're going to be locked in for a year.
Oh, yes, yeah.
No, you can make adjustments.
Yes. You're right.
Yes.
You're right. And we'll talk to you about it.
We'll talk to you about it.
If you've got questions, ask
Talk
us.
to an enrollment center.
Yeah.
Seriously, there's 11 of us. Share the Ricky Lake video. Share the words. Have a great weekend.
All right, thank you.
Thank you.
Bye. Oh my God, come over here.